Good morning. My name is Donna Westbrooks Martin, and I am an education consultant at the Patton Pittsburgh office. Welcome to the National Autism Conference. Before we get started with this morning's presentation, I'd like to go over just a few housekeeping items for you. Today, we will have the exhibit hall open from 8:30 to 5 o'clock. And from 4:30 to 6 o'clock today, we'll have a tribute to Jerry Shook, his legacy and contributions to evidence-based autism interventions in Pennsylvania and the world. So please plan to attend. Also, if you have any CEUs that you need to check out, we'll be doing that at the close of today in our registration area, right where you registered this morning. Okay. So again, welcome this morning to our live audience and to those who are participating in today's presentation via webcast. I'll go ahead and introduce this morning's presenter. Dr. Barbara Scheck is a behavior analyst and speech pathologist with over 30 years experience in behavioral interventions for individuals with developmental disabilities. She has worked in school, home, clinic, and hospital settings. Her workshops, training symposia, and research have been presented in the United States, Europe, and Australia, and focus on the use of behavioral procedures to improve speech, language, and feeding skills for students of all ages with a wide variety of medical and educational diagnoses. Dr. Esch received her PhD in Applied Behavior Analysis from Western Michigan University and her MA in Speech Pathology from Michigan State University. She's the author of the Early Echoic Skills Assessment, part of the Verbal Behavior Milestones Assessment and Placement Program, the EMAP. She is the founder and past chairperson of the Speech Pathology Special Interest Group of the Association for Behavior Analysis International. Her research on behavioral treatments for early speech acquisition appears in the Analysis of Verbal Behavior and the Journal of Applied Behavior Analysis. Dr. Esch is co-owner of Esch Behavior Consultants Incorporated, a consulting company specializing in behavioral treatments for individuals with severe communication delays. Please join me in welcoming Dr. Esch.
Thank you, Donna. Thank you. Well, I'd like to thank the conference program committee. Can you hear me okay in the back? Especially Mike Miklos, who many of you probably know, for inviting me to be here today. It's great to be participating with everybody here at the National Autism Conference here in State College. Before we get started, I will point out to you the number in the top right-hand corner of all of the slides. That number refers to whether the page of your handout. So this slide should appear on page 1 of the handout, and there are 3 slides per page, so there should be 3 red number 1s, meaning that we're still on page 1 of the handout. Now there are some of the numbers that are gray, and when you see a gray number, we're still on that page, but you do not have that slide in your handout. There are some extra slides that I wanted to use to sort of reiterate a point or whatever, and so I didn't want to burden the handouts with all of those, and you don't really need them, but just to help you kind of follow along. So before we get started, let me kind of find out who all of you are. How many speech pathologists are in the audience today? So a goodly number of us. And behavior analysts that don't have a speech path background? Okay, I'm assuming if you're a speech pathologist and you're here, you're either knowledgeable about verbal behavior and a behavioral approach to language assessment, or at least you're very interested in that. And so that's what we're going to be talking about today. It turns out that this is really a discrepancy in how 2 different fields of study talk about language acquisition. This is not a skill building workshop, it's an information talk. And what I hope to do is to talk about this issue of speech and language assessment and why it would benefit from a behavioral analysis in a way that maybe you haven't thought about before, or maybe it'll put the frosting on the cake for some of you that have been thinking about this, and to spark some further research, not only by researchers, but by clinicians as well, some paper writing, some case study publication, and so on and so forth, so that we can kind of move forward in the direction that I feel would benefit both of the fields in terms of how we talk about skill development and preliminarily skill assessment. So it turns out that this is a translation, not just a translation issue between the two fields. In other words, the field of speech pathology is not talking about language acquisition in a way that can be directly translated and understood by those with a behavior analytic background, and vice versa. If you are speaking from a behavior analytic background, you can't just take all of those words that you use to explain language acquisition and kind of translate and say, well, what's the translation in the traditional speech path field for this particular issue? It's more than that. I think we're not just using different words for the same process. There's actually a basic difference in how these professional fields conceptualize and theorize the acquisition of verbal behavior, of language, if you will. There's a real incongruence in how we explain speech and language skills, a difference in how we talk about where those language skills came from and what causes and maintains the difficulties that the children that we work with or the adults that we work with are having. There's a real difference in talking about how we should assess those skills. That's the piece that we'll be looking at today. And most importantly, there's a difference in how we talk about how we use this assessment information to inform our treatment planning. So we have the traditional approach to talking about language acquisition, and we have a behavioral approach to talking about language acquisition. And I'm going to be going back and forth today to talk about these two different interpretations of speech and language skills. I will tell you, Donna and I were talking beforehand, this is not easy stuff. It's difficult, and it's hard even if you want to understand it. It's difficult because of what I just explained. It's not simply a translation issue. And it took me more than a couple of years of really reading a lot and trying to figure out what are those behavior analysts really saying? What do I do with that? How do I make that be different or usable information for me in what I do as a speech pathologist? And now as a behavior analyst who primarily works with that hat on, and the background that I have in language acquisition, it has taken some time to be able to come up with a way, I think, of sort of analyzing, well, what is it that traditional language approach talks about? What is it that what are they about? Why do we talk this way? And what do we do with this? So it may be confusing to try to reconcile these two discussions, and that's hopefully what we will begin to do today. So I'm going to kind of go back and forth to kind of weave what I think is a picture for you. And there's a lot of redundancy in this talk. If you already know everything there is to know about verbal behavior, you have a very, very strong repertoire in that area, you might find the redundancy more than you would need. But not everybody is at that point. And I know from my own background, even though I could tell you what AMAND and ATTACT were and talk fairly knowledgeably about behavior analysis in general and verbal behavior in particular, I still had difficulty trying to sort of go between these two areas. And so if you feel as though, gosh, I think I heard that earlier today, but is she now talking about something different? Probably not. It's probably just an effort that I'm making through some amount of experience to try to re-explain it in different ways, so that if you hear it more than once and you hear it in different ways, one of those may resonate with you more than another. So, what should assessment do? Well, in my opinion, it should do one thing. It should tell us what to do in treatment. It should lead to a treatment approach. And so when we assess, we can assess language skills, and then we assess other skills as well. If we are a soccer coach, we don't assess language skills, we assess other skills. If we're a speech pathologist or a behavior analyst working to try to help someone acquire communication skills, we assess language skills, but we also may assess some other skills. Why do we want to find an efficient, effective assessment method? And that's what we'll be talking about today. What's efficient and what's effective? Well, let's take a look at our time frame with our learner. If this is the trajectory for a typically developing child in a school setting, he starts at the point on the left and progresses at some rate to the point on the right. If this is our learner with a communication delay, and that learner learns at the same rate that the other child does, there will still be a gap at the end of our instructional access period of time. More typically, this is what we see. We see a slower rate of acquisition with many of our children, and so the gap simply widens. So what is our task? Well, this is our task. Our task is to teach so that children that we're working with learn faster, at a faster rate than a typically developing learner. That's a pretty heavy responsibility, and we have no time to waste. We have to select our treatments to be the right treatments, the fastest working treatments, and the ones that are the most durable. So, let's talk about the purpose of traditional speech and language assessment. Traditional speech and language assessment, the purpose, is not clearly articulated in a way that informs treatment. So here's an example. These are some quotes from a well-known textbook on aphasia, which is the speech and language disability that occurs after a stroke, for example, or other injury to the brain. Effective rehabilitation of frontal lobe dysfunctions hinges wholly on what we know about frontal lobe function. So what is that saying? That's saying that we can't fix it if we don't know what caused it. It disregards any influence of the environment and places the hope for fixing the dysfunction on being able to identify frontal lobe function, which is, of course, in the brain. So what are we as teachers to do if we don't know about frontal lobe function? Does that mean that we can't fix a frontal lobe dysfunction? Another quote, the purpose of naming assessment is to specify the mechanisms that are responsible. The mechanisms that are responsible for naming impairment, as well as those mechanisms that are spared. Well, by the mechanism, I take that to mean some part in the brain, not environmental events or actions. Those aren't exactly the kinds of mechanisms that are being referred to here. Another quote, the purpose of naming assessment is to reveal the cognitive bases and the lexical characteristics of naming failure. And then it goes on to say that this will help us in our treatments. This information allows the clinician to select rational treatment interventions and stimuli to most directly impact on the communication issues. So this is, these are three statements of the purpose of assessment that do not clearly lead us to treatment, something that is within our realm. So that's kind of at odds, because the primary purpose of speech and language assessment is to give us some direction for treatment. Why else would we assess? Well, there are other reasons to assess, like we have to have information for an IEP, for example, a yearly plan, or for other reasons. But the primary goal is to give us some direction for treatment. So our job is to describe errors that occur on tests that we give, and those errors will be organized in such a way on the assessment as to give us some direction and tell us what to do. So traditional speech and language tests are based on the assumption that language is a function of linguistic processes. Linguistic processes and structural entities. Well, let's take a look at that. This is exactly how we talk about what's going on with language. We talk about places in our brain that sort of control these things: expressive language, receptive language, syntax, grammar, and so on. This is so pervasive that it almost makes sense to us. We see and hear people talking like this every day. They don't have the concept of hammer, or they don't have the chair concept yet. They misuse pronouns because their pronoun concept is not right. But interestingly, non-language skills are not typically described in these mentalistic terms. They're generally assumed to be a function of the person's environment and the person's body resources. These, if we superimpose these hypothetical constructs onto non-language skills, they wouldn't make any sense to us at all. Because we're not talking about language, but we don't say someone has a raising their hand concept problem. That's why they don't raise their hand. Or they didn't jump well, they have a jumping concept problem. If a football player doesn't catch well, we don't say he has a poor catching concept to explain that problem. We say that he needs more practice catching the ball. So why do we do this? We don't ascribe these non-language skills as being cognitive because we can clearly see the environmental reasons for these errors. We would say she used the wrong word, but we wouldn't say she used the wrong walk. Why not? Because we can clearly identify the environmental reasons for the wrong walk. And it's more difficult to determine, well, what are the environmental reasons for the wrong word occurring? I think we tend to describe language skills differently because we don't pay attention to the environmental contexts that surround language responses in the same way that we do with non-language responses. This is the environmental context for this error in walking. The cabinet door was open, she bumped into the drawer, and her knee hurts. It's a very clear ABC analysis of what happened there. The same, if we have an intact reach skill or intact reach concept, what does that really mean environmentally? The can was visible, you extend your arm and your fingers touch the can. That's what maintains the behavior of reaching toward a can. Antecedently, the can was visible. Consequently, that's what reinforces the reach in that direction and to that extent. So because of their linguistic focus, traditional speech and language assessments describe errors in linguistic terminology. They have a linguistic focus. That's what you're going to get as a result of administering a standardized speech and language test. So linguistic terminology like grammar, syntax, semantics, structural terminology like nouns and verbs and pronouns and prepositions and so on. Here are some examples of how traditional speech and language assessments describes the deficits that it tests. So these are linguistic and structural terms that every speech pathologist has to learn. Yeah, you all are nodding your heads. Yes, I'm familiar with those. So let's take a look at relational vocabulary. A test of relational vocabulary, for those of you that don't have a background in this. For example, shoes and socks are said to have a function relation. That is, they function to cover your feet. Pig and cat have a concept relation. They are both part of the concept animal. And so if you can't name some animals, you have a relational vocabulary problem with the concept animal. So this is, we'll talk more about this profile later of an article that my colleagues and I published. But this is a very common test that we're all familiar with, speech pathologists are, the clinical evaluation of language fundamentals, the SELF. And these are the subtests on that assessment. This is a standardized language assessment. And the relational vocabulary subtests on this particular test are identified under the category called word classes. Word classes 1 for younger kids and word classes 2 for older children. And relational vocabulary skill, not on this test this description is not contained in this test, but relational vocabulary is described as the ability to understand relationships between words that share a variety of functional and conceptual relationships, to interpret or conceptualize or organize information to create meaning. So what you should begin to ask yourself is, yes, if I understand relational vocabulary problems, how do I help my learner organize his information to create meaning? What do you do in the treatment setting to make that happen? How are you going to help your learner make connections between words, as it says? It's hard to know what you're supposed to do. It's hard to even know what this skill consists of without some examples. And when you do get examples, what do you do if the relational vocabulary is a concept relational vocabulary problem like pig and cat versus a function relational vocabulary problem like shoes and socks? Do you work on everything, or do you just work on one or the other? Or are there more? There are more. So these words don't pinpoint what to do for treatment. And why does that matter? this risks inefficiency and ineffectiveness, longer treatment times, and non-durable outcomes. And that's a problem for us as clinicians. So what would you do with this type of error? You say point to your nose, and she points to her elbow. Does that mean she doesn't have the nose concept? So should you work on nose concept or body part concept? Does it mean she has a receptive language deficit because she didn't follow your instruction? And so what do you choose? Do you improve receptive language overall? What should you work on? What if you looked at it a little more closely, and here she is pointing to the elephant's nose on the Band-Aid. So maybe it's a pronoun problem. If you are going to take a look at linguistic issues, then there's a difficulty in terms of leading to treatment. Here's a test item from a popular standardized language test that many speech pathologists give all the time. Which one is little? The correct answer is to point to the baby. So what if the child can do that? You say, which one is little? And they point to the baby. But then you ask them later in the test, what's the opposite of big? And they don't say little. There are several things that might occur to you to work on. You could work on opposites. You could work on adjectives. You could work on general expressive skills. These are other items from another language test. On this one, the item was, what is he doing? And the child says running. So they passed present progressive verb question given a picture. But they failed, say a sentence with the word running. Now they just said running there. And the teacher says, I'll get you started. He likes to run, so he is, and there's no response. Can they not say running? No, we know that's not the issue. They just said it right there. Why did that error occur? How are you going to analyze that? What are you going to do with that? A lot of different intervention options. Noun, verb, sentence construction, verb tense, receptive skills, and so on. Here's another one. Which one is little? Well, this one's like the elephant with tell me the opposite of big, and we don't get little, but they obviously were able to answer another question about little. Another example, say rhyming words. This is an actual item from a speech and language test. Fun, bun, ton, done. Say another one. The child says sun. Great. Now find the one that rhymes with fun. And you're showing them pictures of all of these things, and there's no response. They do not point to sun. How will you analyze that if you're talking about a linguistic problem? More importantly, what does your intervention, what should be selected? So if I want to assess your repertoire with respect to cats, what information do I need? A traditional speech and language test would report your cat-related topographies. That is all the different answers that you could give related to cats within a context that may be a little bit difficult to parlay into a treatment plan. These tests are not designed to evoke, to find out what evokes your whole cat repertoire. They're designed to describe whether your language system is in place or not. Is your grammar, is your syntax, your semantics and phonology, are those in place with the assumptions that if those systems are in place, you'll be able to talk about cats? And because of this design focus, this linguistic structural design focus to our standardized speech and language tests, if the tests reveal that you make errors on cat-type questions, they would lead you to the conclusion that it has less to do with your cat-related learning history than with your deficit linguistic structures. So let's look at this a little bit further. This is items from a traditional assessment. These are some of the ways that a typical error might be described. But again, we're not really sure what to do. So they failed these items, point to cat, and that's described on the exam, on the assessment, as a receptive language deficit. What animal says meow? Is a cat an animal? They don't have the animal or the cat concept. This is how we are marking it on the answer form. These are our available options. What word rhymes with cat? If they can't do that, say catfish without saying fish. If they can't do that, we are labeling that a phonological awareness deficit. And then we need to find treatments for those. So let's take a look at one example. Is a cat an animal? If they get it wrong, we say they don't have the animal concept, possibly the cat concept. So if the treatment isn't really clear, that is, we can identify that they made the error. These are some things that we might do in treatment. Excuse me. And I've probably done all of these before I was able to sort of analyze it a little bit differently. We might have them point to a lot of animals. We might have them name pictures of animals, including cats. We might have them label animals in a mixed array, label cats in a mixed array of animals. We might play with toy animals, and we might even have a cat in there and talk about them. We might have them sorting animal pictures from non-animal pictures, or answering yes and no to, is a goat an animal? Is a chair an animal? Is a pig an animal? And so on and so forth. Or we might read animal books with them. But none of those are going to be useful in getting this response corrected in an efficient, durable way. The child may indeed learn from doing all of these sorts of things. But again, if our trajectory for learning has to be faster and more efficient than a typically developing child, we've got to bring our A game. We don't have any time to waste. And so we need to figure out, should we be doing all of these other things? What's the fastest way from here to there? So that's answering a question about cat. What if we want the child to write the word cat on a test? So let's take a look at what is probably required here from a traditional perspective. This is a linguistic model for producing a written word. The focus here is not on the behavior of writing, but rather on proposing hypothetical constructs to explain how to produce this word. So it's a difficulty if you appeal to one hypothetical construct to explain another hypothetical construct. For example, a child is dyslexic because he has a poorly developed phonological process. You're sort of chasing your tail if you talk like that. The problem is that even if these constructs or these supposed agents were shown to exist, we don't have ready access to them. Where is your phonological process? How do you get access to that so you can fix it and bring about some behavior change? And more importantly, we're liable, if we're focusing on this, to disregard what we could be paying attention to. So writing the word cat is the instruction. Write the word cat And after going through these various processes supposedly taking place in the brain, the written word will be produced. In other words, you'll end up with cat. So here's the instruction again, write cat. And so you hear the word cat, it goes through your semantic system, and because you're not going to be speaking it, we bypass the phonological lexicon. We go over to the orthographic lexicon, the graphemic output buffer, the allographic realization, and finally we end up with the word cat. So you probably recognize that that top part are antecedent events in the environment. You hear a word or you see a word, and the bottom part is the consequent stimuli or events in the environment that happen at the end after some response is produced. So all of this other stuff that's in the middle, behavior analysts would not need to talk about that. That's in some other realm called hypothetical constructs. Presumably it occurs someplace in the brain, but we don't know where that is. And so if we don't know what it is or where it is, we don't have access to it. If we don't have access to it, we can't really assess it with our tools that we have here at this point. And more importantly, there is no treatment based on a linguistic approach or explanation for language acquisition. We don't have it, they don't exist. We don't have linguistic treatments. We have linguistic categories. We say, I'm going to work on nouns and verbs, or I'm going to work on syntax. So where's the linguistic treatment for that? And what most speech pathologists that I've talked with in various workshops and so on readily do and are happy to say they do is tap into the field of behavior analysis using prompting, prompt fading, reinforcement, and so on and so forth. Whether or not they have any knowledge of Amanda, tact, and echoic and interverbal autoclitics and so on, they're quite familiar with prompting and reinforcement. But that did not come from the field of linguistics. So if linguistic terminology doesn't pinpoint our treatment goals, what alternative assessment does offer treatment direction? Well, let's take a look. We have two different kinds of behavior here, speech and language behavior and then non-language behavior. And we have two different environments that are responsible for those behaviors. One of those environments is internal, and it consists of our physical self inside our skin. And I guess we could count our skin also. Blood, brain, biochemistry, nerves, muscles, and bones, and so on. And then there is an external environment outside our skin. Everything else that impacts on that body that we access through our senses. We see it, hear it, feel it, taste it, smell it. Now, for non-language behavior, we're very comfortable saying that your ability to run, for example, or your ability to pound a hammer skillfully, for example, is greatly influenced by that internal environment. What's the physical package that you have to work with? We're also very comfortable talking about the external environment that evokes skillful hammering or soccer kicking and so on and so forth. Were you close enough to the ball? How fast were you going? What was the wind condition like? What were the instructions? And so on and so forth. For speech and language behavior, we're also very comfortable talking about the internal environment that certainly is the control center for much of what we do. If we had no internal environment to provide us with those resources, of course, we would not be able to function at all. But from a traditional assessment of speech and language, this external environment is disregarded in assessment. But something takes its place. That sort of no man's land of hypothetical constructs is proposed and assessed on standardized speech and language assessments, linguistics, structure, structural processes, language processors, syntactic structures are some examples. I'm sure all of you are familiar with the term auditory processing problem. It's a problem because your auditory processing system is not working correctly. Those are things that all of us probably spent a good bit of time memorizing, those sorts of things. This sort of middle area may not be useful for what we are trying to, for what we're trying to do. I would suggest that, and we'll give you some examples, for moving down the road faster with an assessment of the before and after events. Everyone would agree that speech and language consists of responses. The first step is in recognizing that when someone is using language, they are responding. They're not using a word, they are making a response that we call a word. And responses are behaviors. So what's different about the approach is a traditional approach says that these responses are a function of those hypothetical constructs. That's why you're making those responses. And some of them are right and some of them are wrong. If you get it wrong, you got it wrong because something is not quite right in one of your hypothetical constructs, like semantics, syntactics, and so on and so forth. A behavioral explanation, on the other hand, would require the context to be identified. Language is the function of environmental events, and those events consist of before events and after events related to those responses. And what do we do with those responses? We observe them, assess them, change them. We plan treatment from the responses that are made. So instead of saying that Joe knows a lot of animals, and so he must have the animal concept, we would take a look at what do we mean by knowing a lot of animals. We mean that he has a lot of skills with respect to animals. He can make a lot of animal-related responses. And this is the key sort of division between how we talk about things from a traditional perspective and how we talk about them from a behavioral perspective. The explanation for the response is in the environment. He can ask for animals when he wants them. He can label animals. He can repeat the names of animals. He can match animal pictures. He can point to animals and so on. He can have conversations about animals. This is his animal repertoire. And now that's what we mean when we say he has an animal concept. If he can only do one of those things, he can only ask for an animal, or what if he can only point to animals? He has a very weak animal repertoire. That's described as not having the animal concept. But what if we can teach him to do all of these things? Did the concept improve? The skill repertoire broadened, is what happened. So one can ask oneself, do we need to talk about concepts if we're talking about skills and skill acquisition? And so on assessments, that's exactly what we want to do. This is an example of a behavioral speech and language assessment, the VB map. How many of you are familiar with the VB map? Okay, so some know. The VB map is a developmentally sequenced assessment of skills that are acquired by a typically developing child by the age of 48 months. And level 1, those are all of the skills that, or a good bit of the speech and language and some other related skills like play skills and so on, that would be acquired by a typically developing 18-month-old child. And level 2 by 30 months, level 3 by 48 months or 4 years old. And the language skills on this are assessed. You can see them on the left-hand side. Many of those language skills many of them are language skills, and those language skills are described in terms of Skinner's verbal operants: man's, tax, man's requesting, tax, labeling. Those are our quick words for them. Echoic is repeating, and intraverbal skills, conversation skills. So the map yields treatment direction, and it aligns with information from typical developmental scales. So our task is to figure out some priorities for filling in these empty spaces on the assessment, to select what to teach and in what order, so we can move this child forward to having the basic skills that he needs in order to learn without one-to-one assistance. And you can see that all of these skills that we earlier discussed in terms of concept are in fact assessed behaviorally on this example. This is one behavioral speech and language assessment, skills assessment. And so our goal, of course, is to identify, pinpoint those targets in those various skill areas and move the child forward as quickly as possible. So, this looks like a strange question in the middle of our discussion. What does pickle mean? And probably all of you are imagining what a pickle looks like. So the right answer, of course, is, you probably have figured it out by now, it all depends. It all depends on context. And if I asked you, do you have the concept of pickle, everybody would say, sure, I know what a pickle is. But what is your pickle repertoire? How broad is your repertoire with respect to pickles? Can you do, for example, let me just sort of back up, can you do all of these things with respect to pickles? Can you have conversations about them? You can certainly label them. Can you match pickles? Can you ask questions about pickles? Maybe more than, is this dill or is this sweet? Or bread and butter or grandmothers. You can certainly repeat it if I said everybody say pickle. Can you point to lots of different pickles and things related to pickles, like pickle cracks and so on and so forth? I don't know about imitating a pickle or playing or having leisure skills. Certainly making pickles would be an adult leisure skill with respect to pickles. So here's one context for pickle. But that's not the only context for pickle. This is another pickle context. As in, they are in a pickle. So the context in which you would talk about pickle and cucumber are very different. That is very different than the context where you would talk about pickle and a predicament. Not the same context. But if you can't do both of those things, then would we say that you have sort of a weak pickle repertoire? I don't know, maybe. But I would be more comfortable saying you have a weak pickle repertoire than saying that you have a weak pickle concept. Because I could teach this repertoire, and I'm not sure how to teach the concept. It's a fuzzy word that doesn't empower me as a clinician to know what to do about that. Here's another context, context one for safe. But here's a completely different context for safe. As Mr. Mouse is probably very glad that he is, because that's a sure thing that he's not going to be around for very long if he's not safe. You could, of course, discuss these different contexts and probably a lot of other contexts, but with respect to the word safe, the word run is a word that in the English language has probably, I don't know, I think I heard one time 16 to 20 different meanings, probably many more than that. There are lots of different meanings for the word run. What do we mean by the word mean? Well, what do we mean when we say they don't get the meaning of cat, for example, or pickle, or run, or safe? That's kind of not the right question. Meaning is in the context. And so a word means whatever the context is. Here's the way to ask that question. Under what conditions does a person say cat, or safe, or pickle? Under what conditions? Now you know what to do about it if you're teaching it. So what does the response cat mean? Well, it's not informative without the context. So let's take a look at 4 different contexts. This, for those of you who are speech pathologists that don't have much of a behavior analytic background, now we're moving into sort of the nuts and bolts of how would you take this meaning or concept and talk about it like a behavior analyst would in order to assess all of the different contexts or functions. And that's what I showed you on the VB map, and we'll take a look at some other examples in a bit. So what does cat mean? Well, you can see that we have these 4 different responses in the middle. What we're going to build is a learn unit of antecedent response consequence, or antecedent behavior consequence, or ABC, all different learn units. And you can see that the response cat is not very interesting. When I get called in on consults, I'm frequently a parent or a teacher will say, my child knows his animals. And I say, well, what can he do with respect to animals? Well, he can name them when he sees them. So he can say horse when he sees a horse. So that's good. That's certainly one skill. What else can he do with respect to horse? Well, that's what he can do with respect to horse. So now we have a sort of a weak horse repertoire, if that's all you can do, you're not very empowered language-wise. You don't have very many other contexts in which you can say horse. So I'm not very impressed by, for example, the fact that a child can say cat. Your question, if somebody says, yeah, he can say horse or cat, your question should be, under what conditions can he say that word? Can he say it if you say, tell me an animal that has paws and a tail and fur and says meow? Now will that person say cat? Or can they only say cat if you say, what's this? And hold up a picture and they say cat. From a traditional perspective, we would assess that on speech and language traditional assessments, standardized assessments, and say they can name cat, but they have conceptual problems on other items having to do with cat. Well, our job is to pin that down. What are we talking about? We're talking about context. So here's one context or one function. Somebody says, say cat, and the person says cat. And that's maintained by general social approval or responses. Yeah, that's right. Another function is that you can say cat when you see one. Like the little child that says, Mommy, airplane. Or somebody who smells fire in the theater and smoke and yells fire, partly wanting to have folks get out of there, but also, have you ever walked into a room and said, oh, popcorn or coffee? Maybe you don't want it necessarily, but you're able to identify it, to label it, to tact it. Tacting as in contact with your environment. Tacting something that's impacting your senses that's not language. You might also answer cat if somebody says, what's your favorite animal? So here we have language or verbal behavior on this person's part and a language or verbal response over here, but they don't match. As opposed to this one. That's verbal behavior, and that's verbal behavior, but they do match. We call that echoic. If they don't match, we call that intraverbal. What's your name? George. Intraverbal. And then, of course, there's another function that we're all very, very glad that we can emit. We want it, we say it, and in order to train it, the verbal community trains us by giving us that very, very early on. And this is called, in verbal behavior, a mand, like demand or command. These are very bare bones explanations for the four elementary verbal operants that Skinner discussed. But I'll give you a few other examples of these. So we have one response form, unremarkable, not very interesting, not helpful to know that the child can say cat. What's helpful is to know under what condition, in what context. What do we call these? We call these response functions. So just to give you another example with cookie. You want a cookie, you say cookie, you get a cookie. Sometimes you don't get a cookie, but again, the verbal community needs to train this early on so that we, under conditions of being motivated to ask for something, we say it and it's reinforced by access to the specific item. And that's called a mand in verbal behavior. And it's the first skill that we teach children with communication deficits. Why? It gets them hooked on language very, very quickly. It teaches them when you open your mouth, or when you sign, or when you select a picture, or not writing at that age, but if they were to write, any verbal response, very, very powerful. It works, and it works quickly. So man training has to work very, very fast, early man training. But as we'll see later, it's almost never assessed on traditional speech and language assessments. So a tact is a nonverbal stimulus in the environment that you see, hear, smell, taste, or touch. Non-language stimulus. You say it, and that skill, that function, is maintained by general social reinforcement. All of these are maintained by social reinforcement except the first one, which is maintained by access to the specific item. So another look at this, the conditions that evoke a language response. You want it. A response under that condition is called a man, something that impacts your senses. A response that you make based on that antecedent is called a tact. Verbal information that doesn't match your response, when you make a response to some verbal stimulus that your response doesn't match the stimulus, that's called an intraverbal. And if it does match, that's called an echoic. So if I say, "What's your name?" and you say, "What's your name?" that would be labeled an echoic. If I say, "What's your name?" and you say, "Sue," that would be labeled, called an intraverbal skill. Even if your name isn't Sue, if I say, for example, to a child, "How old are you?" and he says 3, and I know he's 4, it's still an intraverbal skill. It's a wrong intraverbal, but it's an intraverbal response. Intraverbals, as you can probably tell, are it's a huge area because there are so many of these that can evoke a response. For example, how many things could I say that you would respond cookie? What does Keebler make? There's 1. Chocolate chip cookie. There's 2. Milk and cookie. There's 3. And so on and so forth. Name something we put sprinkles on. What do we bake in the oven on a cookie sheet? And so what did you eat when you got home from school this afternoon? Cookies, so on and so forth. So varied that it's difficult to assess it completely. And I don't know that we ever do. But we can assess it much more clearly than what we're doing right now. I'm going to skip this slide because it's just like the others, and I think we're coming up on a break in about 5 or 10 minutes if I'm correct. So we'll finish up this section and then I think we'll take a break. So imagine that this is the context, the universe of everything that you will ever say, or your learner will ever say. What we want to do as assessors of language and teachers of language is to assess a sample of your repertoire. We can't assess everything. So we want to assess a sample of your repertoire. So here's some examples. I want to know what can you do with respect to music, pizza, swing. Those are nouns. If you want to talk about linguistic structural labels for those words or those responses, but it doesn't have to be that way. I also want to know what you can do with respect to words like push, a verb, or adjectives like green or cold, or prepositions like with or on. I want to know what you can do with respect to a sample of words or topographies or responses. And I want to know specifically, can you do that under the context of wanting it? I want to train that. I want to assess that and train it as a man. Do you want that cookie with chocolate or without? With or without? With. Now with is a man. That's how I might assess that. Do you want that ketchup on the hot dog or off the hot dog? Now it's a man if they respond on, and so on. What do you want to play next? Swing. What do you want me to do in the swing? Do when you're in the swing? Push. Push me. We're assessing mands and teaching mands. And now my job is to find out, with respect to this sample of words, and we usually, typically, clinically, would select maybe 150 to 300 sample words. I usually have teachers and parents make a list of the things in categories that you think are the most relevant to your child's life. What does he see and hear and touch on a daily basis? Chair, toothbrush, cookie, mommy, daddy, fluffy, and so on. Bed, pillow, socks, shoes, and so on and so forth. What kinds of things does this child encounter that he or she needs to talk about on a regular basis? And so here are some examples. I also want to assess, can they say those things when I say them? Because often what we do when parents or teachers tell us, oh yeah, he knows cat. He knows pizza. What does he know? What can he do with respect to pizza? He can say it when I say it. Can he ask for it when he wants one? Can he label it when he sees it? And can he talk about it when I ask questions? Or when I make comments, can he keep the conversation going? So within the universe of language skills, of everything that this child would ever need to say, we can't assess it all, but we can assess a representative sample and then assess within the function, within the context, and assess broadly across relevant contexts like mands, tax, echoics, interverbal skills, and pinpoint where's the weakness. What do we need to do to help this child move forward? We're sampling the same topography across all different functions, all different contexts. And as we'll see later, unfortunately with traditional speech and language assessments, because they're not organized in this way, we might get a lot of information about the child's ability to name these things, but his interverbal skills, which are not labeled interverbal skills, might not be about the same things. So if I have the word car, for example, and I want to know across the behavioral repertoire, across the skill set, can he match? Can he point to? Can he ask? Can he label? Can he repeat? Can he point to it by feature or function or class or category? Can he label it by feature, function, or class? What color is this one? How does this one feel? And can he talk about it by feature, function, and class? the broad skill area, I might not know more than that he can label it, for example. So I don't know, I don't have the information I need to plan a cohesive language training program if my assessment isn't arranged to provide me or to yield that kind of information. More importantly, what if he can name it, but he can't do anything else? He can't talk about a truck. He can name a truck, but if I say, can you tell me another vehicle, not a car, not a train, but name another one? Can he say truck? You would all be able to do that in short order. So your truck repertoire includes that interverbal skill. By category, name some vehicles. But what if he can't do that? What do I need to do? Well, I'll give you an example in a bit on another slide of how we can use these transfer techniques to move from one skill area to another in our treatment program. So it's vital that we know, can he tact it but not give an interverbal response for it? I need to know that, because if he can tact it. I can use that tact as a prompt to transfer the skill and bring it under interverbal stimulus control. And now I've got 2 for 1. I started out with him only being able to label a truck when he sees it. But if he can do that, I can take that as a prompt and put it at the end of the part that doesn't work, name a vehicle, and I know that this will evoke a correct response, and then I can simply fade that out. Very powerful treatment intervention that comes from behavior analysis. Do we need to break at what time? Okay, all right. So okay, we'll be right on track to do that. So in summary for this first part, words are learned in ABC units, which you've seen, antecedent, behavior, consequence, and there are different types of those units, different functions. We have an echoic function where the antecedent is verbal and the response matches it. We call that echoic. We have an interverbal function where the antecedent is verbal and the response does not match it point to point. What's your name? Joe. We have a mand function where the antecedent are motivating operations, motivating conditions, and under those conditions, I say it or emit a verbal response. I can write it or sign it. And the consequence for that is the specific item reinforces that response, access to that specific item or situation. And we have a tact function where the antecedent is nonverbal, non-language, something I see, hear, smell, taste, or touch that's not language, and that evokes a verbal response on my part. Airplane, mouse, or coffee. And now it's time for that. And so we would say that meaning is defined by these verbal functions. That's what we mean by what does something mean. It means how it's used, the context that it's used in. And so with that, let's take a 15-minute break, and we'll meet back here at 10:30. Okay, welcome back to the second half of taking a look at why speech and language assessment needs a behavioral analysis. I think we're all just about back in from coffee. So we are on page 13 up here, and since that number is in red, that means that you should have that on your handout, this particular slide. I did skip one slide, the one just before it. I don't know whether that was in red or not, but we'll start with errors occur in context. So obviously, errors occur in context. Almost everything, I guess, must occur in a context of some sort. So if errors occur in context, what does that mean? That means that if we have an error, we have to identify the context, the antecedent events and the consequent events. What happened before that error occurred and what happened after that error occurred. This is our focus in teaching. It's our focus in intervention. It's our treatment focus, and the plan depends on our ability to identify the error, decide which errors we're going to try to fix, and then identify, well, I've got to do something before the response occurs, and now I'm going to evaluate if it's a better response than the last one, and now what am I going to do to lock that in, to make sure that that response occurs in the future. And in the description that you saw earlier of the 4 elementary verbal operants, mans, tacs, echoics, and interverbals, you saw that 3 of those 4 get locked in with primarily social reinforcement. We do use backup reinforcers to lock them in with some of the kids for whom social reinforcement, that is praise, and social approval is not yet an effective strengthener of their responding. But very quickly we know that we need to get rid of that. Why? Because it has to be that echoic, tact, and interverbal skills are maintained, and they only will be maintained by the general verbal community with social approval, praise, response from someone else. It will not happen that if these kids go into some non-behavioral training environment or a store in a mall or a restaurant, and they say something to somebody else or they're introducing themselves in a social environment, it will not be that when they say, "Hi, my name is Joe," that somebody hands them a piece of popcorn or a Skittle. It can't be that way. The verbal community at large doesn't maintain verbal behavior like that. And so our training environment has to be one that mimics the verbal community at large, because we want those skills to be durable once the child flies out of the nest, goes out, the little birdie is done in the nest, goes out of the nest. Once that learner goes out into the world at large, we want them to be successful. We want their new skills to be durable. We don't want to say, oh, they can only do that in the therapy room. That's not a very strong skill. And so we want to make sure that the echoic, interverbal, and tact are maintained by social consequences. The MAND, of course, is not. It's the only one of those 4 that is not maintained by social consequences. It's completely unnecessary when someone says, "Can I have a cookie?" for us to say, "Nice asking." Now, we do say that to children because we are children who are already under the influence of praise and approval from adults. That's how we teach them what polite means and so on and so forth. But it is not a requirement of that learn unit. In fact, if the child says, "May I have a cookie?" and you said, "Nice asking," that might maintain asking, but not for very long if you never delivered what? The cookie, right? And so it's the specific consequence, specific to the response, that maintains demand. So getting back to this slide, if there's an error with a mand and echoic attacked or an interverbal, we have to identify the context of that error. We know we teach error repair in context. It has to be that way. And so we have to assess error occurrence or error analysis. We have to do that in context. And this, as I talked in the first half, is what is missing from traditional speech and language assessment. The context is there, but it's not recorded. And speech pathologists are some of the best trained people I know to observe. We all had a lot of training in observing very, very critical, very small details of human behavior. If we're able to tell the difference between a voiced and a non-voiced plosive, which is the difference between the p and the b sound, we certainly have learned how to listen very, very carefully, observe, take data, graph, so on and so forth. We've got those skills as speech and language pathologists in spades. What we are not doing is recording on our assessments the contextual information for the error occurrence. So let's take a look at some linguistic-based targets that might be yielded from a speech and language evaluation. Again, the context is not written down, and so we might find out that, for example, the child has problems with pronouns or receptive language or verb tense or so on and so forth, and we might actually write that down on our assessment form. Once we've identified what the errors are, in the absence of context in this case, and with the linguistic-based targets, we now all have to find a procedure, an intervention. What am I going to do about that verb tense problem? Now, here's where the mismatch starts, because procedures, what are procedures? They're contextual descriptions of what to do. In other words, what should I do and when should I do it? That's what a procedure tells you. It's a contextual description. What is that? When should I do it? When he does this, what should I do? And what should I do antecedently to evoke that response from him? So you're very interested in knowing what the procedural context is for your intervention. What happens before? How am I going to help him make a response? And when he does make a response, if it's right, I'm going to do this. If it's wrong, I'm going to do this. I have to know that as a clinician, as an interventionist. Well, unfortunately, there are no linguistic procedures based on these kinds of targets. They simply don't exist at this point in time. So now we have an issue that what typically happens is we have this information and we turn someplace else for the intervention. Well, let's take a look at function-based targets. If we identify these same kinds of issues, but within the context of a mand, a tact, an echoic, and an interverbal, to start with these four, now we have a context. Which pronoun isn't he using correctly? And is it as a mand, a tact, an interverbal, or an echoic? Now you've got the information that you need to correct the error. And these are your procedures that we have from the field of behavior analysis that we can use. An ABC analysis, errorless teaching, error correction, differential reinforcement, prompting, prompt fading, motivating operations, and stimulus control. What I was talking earlier about transfers, and I'm going to take you through in a moment a fairly detailed example of that of one transfer procedure. So let's take a look at interverbal. Let's say we have identified an interverbal problem. Here are some actual items from a speech and language, standardized speech and language assessment. These, maybe some of you will recognize some of these items, and they were all coded by me as interverbal skills. Because in order to get the child to say what he's supposed to say, this is what you say. You say, Joe likes to cook every day. So yesterday he, and then the learner that I'm testing is supposed to say cooked, right? This boy is running, and this boy is whatever the response is, whatever the boy is doing in the picture. A person who sings is a, and then the child fills in the blank. So we have verbal behavior that does not match the verbal response, point to point. That is, they don't just repeat what you just said. That would be an echoic. So these are interverbal skills. Now, on the test, these are how these skills were described. These were the test items, and they were described using all these different words. Sentence completion, naming, grammatic completion, word structure, using concepts, completing similes, and morphology. If I take those test items and call them interverbals, I now know I have a set of procedures to fix interverbal errors. But I'm not sure how to fix a morphological error because I don't know what the procedures are that I'm supposed to use. Now, it's fine if you want to say, for example, well, what do we arbitrarily call that? We call that a simile. And he's going to complete the simile. Okay, but that does nothing to help me move forward in my treatment program. It's interesting. I find linguistics very interesting as an arbitrary discussion of arbitrary categories, names that we make up for these hypothetical constructs that we want to call things, but it doesn't inform our treatment direction. And so, as you saw in the previous slide, we can now, with an interverbal skill, we can simply apply our behavioral procedures and we can correct errors. So let's take a look at an error analysis example from linguistic to behavioral. So here's a subtest for relational vocabulary. We'll take a quick peek at this. You saw this slide before. Relational vocabulary on this test, on the self, is called word classes. And here are some examples from that test. Here is a receptive example. Point to the ones that go together. So point. You don't have to emit verbal behavior, just point. And now you have to emit verbal behavior as an interverbal. How do the words blank and blank go together? How do the words shoes and socks go together? And the correct answer is you wear them both on your feet, or something like that. Or feet might even be an acceptable for some points on this test. So these are relational vocabulary, but we see that one is a listener response, point two, and one is called receptive language item, and the other one is an interverbal response. Now, it might be useful within the category of interverbal skills to say, we're going to work on a bunch of these. How does this one go with this one? And we can call that relational concepts if we want to, but it doesn't necessarily, it just helps us categorize maybe what our targets are. It doesn't, it's not particularly useful prior to that in terms of knowing what to do. So what we did, in a paper that my colleagues Ash Lalonde and Ash published in 2010, we took 28 speech and language assessments, standardized speech and language assessments. This is one, and it's from the table number 5, receptive and expressive language tests. And we took all of the items on all of these 28 tests and we coded them according to some of the verbal operands, mans, echoics, tags, interverbals, and then 2 nonverbal categories called textual is verbal, 1 nonverbal category, which is listener skills or receptive skills. Because I wanted to know on sentence structure, for example, what are those verbal skills or nonverbal skills on that test? What is a person really being asked to do? If I said to you, what are the antecedent and consequent events for a sentence structure item? You would not be able to tell me what should the person do before the response and after the response in order to get a sentence structure response. So, for example, we see that sentence structure tested primarily point to or listener skills, but it also tested echoic, tact, and intraverbal skills as allowed prompts or probable other skills that were needed. So with the relational vocabulary section that we were looking at before on word classes, we can see that what that skill is an intraverbal skill and a receptive skill, but the child also has to have echoic and tact repertoires with respect to those test items, or he'll get them wrong. So this is very useful information to have for your treatment planning. We'll come back to those and look at those in a little bit more detail, but let's go through one example of an error on a test. I apologize for looking at the screen, but my computer screen in the mode that I have it in, I can't even read the example, so I have to sort of turn my head away from you. My apologies. So on this item, what is he doing? The child responded correctly, running. But there's another item on this test that said he likes to run, so he is, and the child did not respond. We got no response on that test. Running. So running is the right answer. So what do I do? Do I say he can't say running? No, he just said running right here. So some possible language deficits that might be identified by traditional tests is noun-verb construction, sentence completion, verb tense, or possibly repetition. The error could be classified as any one of those things on this test. So what do we do to fix this? Because this is not useful information at this point for us. What is useful information is to do a functional analysis of the right response and the wrong response. That is, what were the antecedents to the right response? And for right now, we'll just assume the consequence is a reinforcer. And what was the antecedent for the wrong response? What happened right before the wrong response occurred? What happened right before the right response occurred? So let's take a look at that. We've got the antecedent, or the before, and the response, and the consequence would be over here, and I left that part off. So he likes to run. He is running. That was the teacher said that, or the examiner says this, and the examiner shows a picture. So there are 2 sources of stimulus control for this response that did not occur. So something's not effective. One or both of these was not effective to evoke a correct response. In other words, these stimuli here did not work. They did not evoke a response. So that's the first part of our analysis of the error response. So let's look at the analysis of the correct response. Here are our antecedent stimuli. The teacher said, "What's he doing?" and showed the same picture that was right here, and the child said, "Running." So the picture is not what's evoking the response completely. The picture and that question evokes a right response. The picture and that question, or that format, does not evoke the same response. So he doesn't have a concept problem with running. What he has is a stimulus control problem. This stimulus is controlling that response. These stimuli do not control the same response. It's not the response that's interesting or useful. It's the antecedent and consequent analysis. It's not that he can't say running. He can say running. But under what context can he say running? So this one did work. So using a transfer procedure where I had all the little arrows going back and forth from manned and echoic and tact and so on, this is what we do. We take the one that works and we put it at the end of the one that didn't work. And then we fade it out. We show the picture and we say, he likes to run. He is. And then we say, what's he doing? Because we know that the picture and what's he doing will evoke the response. So we take the part that does not work, is not currently controlling the right response, and at the end of that we put the part that does, the stimulus that does currently control the response, and we know we'll get the correct response. And if we fade it out, we have now established a new source of stimulus control. So what does that mean exactly? Well, let's take a look. This is already effective. These stimuli already effectively control the response. So there's one source of stimulus control, the question, what's he doing, and the picture. This source of stimulus control, he likes to run, he is, and the child now says running, because of our transfer procedure, is now the new context that will evoke a correct response. So we're strengthening his running repertoire, that is the context, the conditions under which this child will emit the response, running. We don't have to wait for him to get the concept of running. We just have to improve our teaching of which stimuli are controlling that response. And the more stimuli that will control that response correctly is what we call, he's got the meaning, he's got the concept. What he really has is responding under multiple, varied stimulus control, which is sometimes a good thing and sometimes not a good thing, as we'll find out in just a bit. So a couple of take-home points then to where we are right now. Traditional speech and language assessment occurs within a context, but those contextual variables are not reported. Certainly, when you do testing, there is a before and there is an after, but you don't write it down. You're not attending to it. Why aren't we attending to it? Because we don't have any tests that do that right now that are standardized speech and language tests. There's no place on the form to write that information. There's no procedures for testing that way. Hopefully some of you that are here or that are listening to this webcast will be interested in providing the field with this critically needed information. This is a problem that we're not writing this down because we can't be sure what stimuli are controlling the current error responses. I know he made an error, but I don't know why. Why don't I know it? Because I wasn't attending to those details. Error responses on traditional speech and language assessments are reported in non-behavioral terms And those terms fail to specify how to change these behaviors. We don't know what to do if we talk about the errors in the way that we're talking about them right now. And this is a problem because behavior change is the sole aim of intervention. Why else would we be doing intervention if we didn't want to change behavior? And how can we change behavior if we don't know the context in which it occurs? So this is the paper that I mentioned that I published with my colleagues Lalonde and Esch a couple of years ago, and I'm happy to send that to you or give you the reference if it's not clear on your handout. But let's talk about some of the issues that we found in going through this database of 28 speech and language assessments, and you'll see what some of them are. We took a look at 6 different types of assessments: aphasia tests, apraxia tests, which is a motor sequencing issue in the absence of sensory loss, articulation and phonology tests, receptive expressive, total language tests, and then just expressive and just receptive tests. These tests were categorized according to these types of problems. And this is the number of those tests that we looked at. For example, with expressive, we looked at 4 standardized assessments. We looked at 7 receptive expressive assessments, 4 apraxia tests, 3 aphasia, so on and so forth. And we coded every item on every test according to whether those items were what were they really testing. So we looked at mand, echoic, tact, interverbal, textual, and receptive skills. And we looked at, of these skills on each of these tests, how many of the items, for example, on an aphasia test, were echoic. How many of the items on the aphasia test were listener skills, and so on. And you can see that manding for aphasia, there were no items on an aphasia test. This is a real problem for generally older adults who used to have an intact language repertoire, who are now having physical issues as a result, and language issues as a result of a stroke or some other injury to the brain. We don't assess, at least on these 3 items, how do they ask for things? How do they get what they want? We have no information about that. It's a critical omission. And yet, I've worked in hospital settings and in home rehab settings and in nursing home settings where that's the first thing everybody wants to know. How does Mr. Smith, what is he doing? What is he asking me for right now? What does he want? He's groaning, he's making a noise, he's pointing, he's really upset. I don't know what he wants. What does he want? We have no way of knowing that from the current assessments. Apraxia tests, and so on and so forth. So that's what we took a look at. We also coded the tests in another way. Or graphed them in another way. Here's our function. It's this graph flipped on its side. So you'll see these on the other side here, or the functions rather. We looked at what was clearly the stimulus that should control the response. That's the dark blue line. So for intraverbal skills, there were this many items that clearly required an interverbal repertoire, but there were this many more that probably required an interverbal repertoire in order to benefit from prompts that were allowed on the test. So this is an example of an apraxia, part of an apraxia assessment. This is from the Kaufman speech praxis test. And these are some of the items. Ask the child to repeat what you say. And so you say bubble, say mommy, say baby, and so on and so forth. And when we evaluate the Kaufman apraxia profile, we also looked at the apraxia battery for adults. These are some of the other ways that you get people to respond. Watch me, listen to me, say it with me. It's sometimes not on the Kaufman, but in other tests it's called integral stimulation as opposed to an apraxia test. What is this test? It's primarily an echoic test. Say what I say. Say it like I say it. But here's kind of the difficulty when we coded all of these other things. For example, on this one, the person can't get the diodocokinetic rate item correct, say puttica, 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 or whatever, which is an echoic skill, if they don't have listener skills. They can possibly get the item wrong. So do they have an echoic problem or a listener skill, a weak listener repertoire? And what are you going to do about that? You can see also that, for example, on this test, it's an intraverbal skill. So although we're labeling if they get it wrong, they have an apraxia problem. If they have a weak intraverbal repertoire, they are likely to get this incorrect. But that's information inherent to the test because it's how you ask the question, but we're not collecting this information when we test. And so we're identifying errors in linguistic terms that don't help us plan treatment, and at the same time, we're not collecting information that would help us plan treatment. So, some problems that can affect treatment goals, and I wanted to show you these, kind of go through these ahead of time, and then I'm going to show you examples of each one of these. On many of the tests, the labels are wrong or imprecise or they're misleading. That is, what we say we're testing is not always what we're testing. There were some tests where the items were labeled as listener skills, but they were really speaker skills. So it was items on a receptive test, and yet we're asking someone to say something. Labels did not reflect actual skills that were required in order to get a plus on the test. The stimuli that currently are required to evoke the response are not tested or reported. And labels that were reported didn't do very much to help us. And as I mentioned before, man functions are rarely evaluated. There were no instances of direct observations of mans on any of the items, and I don't recall the exact number. I think we coded around 600 test items. So here's the aphasia test, one of the aphasia tests that we took a look at. Here is the subtest description. These are the implied functions. That's our best guess about what these items are really testing. You'll notice here that on auditory verbal comprehension, labeled as a comprehension test, it requires intraverbal and textual skills. Those are verbal skills. Those are not listener skills. Those are speaker skills. We have no mans on this test, which I spoke to a moment ago. So out of 475 response opportunities across 3 tests, there were no man functions tested or reported. Here's the a test that we did code a manned item on this. And this particular test illustrates a problem that we see sometimes with these tests. Under receptive skills, the response that's being evaluated is clearly not receptive. Say bye-bye. And it's also being influenced by the echoic model. So nobody should be surprised with the echoic model if under non-echoic conditions the child doesn't say bye-bye to grandma without you saying, say bye-bye. Another item, this is one of the manned items on the receptive expressive emergent language test. They did take a look at, we coded this as a manned item. Does your baby use words to tell you that she or when they want something, or do they say no when they don't want something? But it's an informant test, so it's not a direct manned assessment. From the PLS, the preschool language test, we have what do you want, evoking a manned. So mands might be under prompt control. The crackers are there. I'm saying, what do you want? And I'm saying, I've got crackers. So we don't know, is it their ability to ask for something that they want only under the control of a motivating operation. If I need something, I'm in big trouble if I have to wait for you to ask me if I need something. I have to be able to do that just under the control of motivating operation. You'll recognize these plates possibly from the PPVT, the Peabody Picture Vocabulary Test, point to drinking, and yet, although this is primarily a test of receptive skills or listener skills, one cannot get these items correctly if they can't tact and if they can't echo. At least those skills we think are probably key to supporting the listener skill. So, so those skills may additionally be needed. Also, under the TACO, the Test for Auditory Comprehension of Language, we have three different names: vocabulary, grammatical morphemes, and elaborated phrases and sentences. And you can see that they're all coded the same way. So we have the same functional skills, the same contextual environment, the same before and after learn unit, but we're calling them three different things. Now that may be okay once we've identified these things that we need to work on, and then we want to categorize within the function. But to categorize without knowing the function doesn't help us move forward in our treatment plan. This is from the table on Arctic and phonology test, the CTOP, comprehensive test of phonological processing. And phonology is defined as difficulty understanding the rules of a sound system. It's obviously not a behavioral description of what phonology is. So phonology is a hypothetical construct. It's a made-up term for an arbitrary category that we're going to say there must be rules for the sound system. We're going to theorize that there are rules for a sound system. Certainly we know that people do follow certain, they say things according to certain conventions in verbal behavior, but this description says that we're going to call those rules. And if you get those things wrong enough, we would say that you have a phonological processing problem. Another a description of subtest here, non-word repetition. If you can't repeat non-words, this is used to assess an individual's ability to code and temporarily store information phonologically. So what does that mean? What that means is you can't do this. So I say, here's the antecedent condition. Say it exactly as you heard it. And then I say these words, and then you repeat exactly what I say. And they're written here with some markings to help folks, the examiner, know how to say the word. What does this test? This is an echoic test. It's not necessary that we call it phonologic processing at this point. it might be useful to have some of these test items to train, but what we need to know is the echoic repertoire is weak. And how do we fix an echoic repertoire? We teach point-to-point correspondence with repeating. And speech pathologists are masters at doing this, knowing which targets to select and when to move off one target area and move into more difficult target areas. So I think this area in particular, articulation and the echoic repertoire, is an area where the field of speech pathology and speech pathologists as professionals can make a strong, strong contribution to the field of behavior analysis. Looking at this same test, you'll notice again, this is called phonological processing test. There's a skill here called elision. And elision is the omission of sounds or syllables. So here are some examples of elision. Say popcorn without saying corn, say baseball without saying base, and so on and so forth. So what that really is an echoic skill, but it also is an intraverbal skill, because it's verbal behavior that does not have point-to-point correspondence with the antecedent. So if I say popcorn without saying pop, if you say popcorn without saying pop, that's an echoic. If you say anything else, it's an intraverbal skill, because there's not point-to-point correspondence. Now, what did you say? Did you say it correctly or didn't you say it correctly? Requires an echoic skill, and probably a self-echoic skill as well. So in this case, we're calling it elision, and here, if we do it backwards, we're not calling it unelision, we're calling it blending words. What do pop and corn sound like together? Can you blend those? Same skills are required here. So we have two different names for the same antecedent behavior consequence function. And by the same token, if we have rapid color naming and rapid object naming, those are actually the same skills as well. And memory for digits, non-word repetition, and blending non-words are all echoic, and yet we're calling them three different things. Not a problem if you don't want to plan treatment. But if you want to plan treatment, this is the information that you need first. Now, you'll notice that here we had, let me go this way. Here we have the phonological processing that's called elision on this phonological processing test. But now on the receptive expressive language test, a test of language development, we have the same items. And here it's not called elision, and it's the problem of not being able to do it is not called phonological processing. Now it's called phonemic analysis. It's also called on other tests word sound deletion and phonological awareness. And we can see that it's an echoic and an intraverbal skill. The last part that I want to talk about today, then, is sort of a complex, detailed category of the kinds of things that we've been talking about with respect to responding. And those are called conditional discriminations. I'll give you lots of examples, but it's probably likely that children who make errors on a lot of the complex language items on standardized speech and language tests have difficulty with conditional discriminations. And so what are conditional discriminations? Well, here are some examples. When we look at this is a plate from the PLS, the preschool language scale. Point to the tallest one. After you point to the dog, point to the cat. Don't point to the cat unless I point to the turtle. You can't do that if you don't have skills in conditional discriminations. Can you describe behaviorally what a conditional discrimination is? Because if you can fix these errors. And if you can't, then you run the risk of sort of hop, skipping, and jumping around from target item to target item without a cohesive treatment plan. Once you can behaviorally explain how conditional discriminations are acquired, and I'll take you through that briefly with one or two examples, you will be able to arrange your treatment so that you can fix conditional discrimination errors. And it doesn't matter whether they're simple ones like this or really difficult ones like that. I would have to stop and think, wait a minute, don't point to the cat unless I point to the turtle. Okay, wait, should I point to the cat or the turtle or not either one of those things? Okay, so this is an example of not a conditional discrimination. This is just a plain old simple responding discrimination that does not require conditional discrimination. Another sort of word for conditional is it all depends on something else. It's conditional on something else. So if I say point to drinking and the child points to this picture, what do I know? I know not very much. Getting the right answer only depends on hearing point to. It does not depend at all on hearing the word drinking, because there isn't any other picture there. You can get the right answer simply by pointing. It would not be a right answer if you pointed to the blank part of the page, but that's a separate issue. So let's take a look at a conditional discrimination. Now we have 4 pictures, and I say point to drinking. So we've got 2 stimuli that are controlling the response. Point to drinking and that picture right there, but we have some distractor items. The strength of the drinking picture, that's this one, to evoke the pointing response, instead of the strength of one of these other pictures, is conditional on the teacher saying drinking and not saying car or table or tricycle. So being able to point to this one depends on what the teacher says in the face of the distractor items. So let's take a look at some other examples. This is the way we often assess children, as well assess their repertoires, as well as teach them. Point to the dog eating, point to the dog sleeping, point to the dog doing all these other things. What are we teaching the child to disregard? We're teaching him to disregard point to dog after the first couple of items because it never changes. So what we're training him is that part doesn't matter. Don't listen to that part. The things that we pay attention to in life, we pay attention not to stimuli, but to stimulus changes, as Jack Michael talked about in my many graduate classes that I took. It's stimulus change that human beings pay attention to. That's why police cars and emergency vehicles like ambulances and so on don't have a steady tone. They have a warble tone, woo, 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 because it's more likely to be attended to. That's why the light is not always on. It flashes. That's why the tower lights for airplanes to be aware of flash on and off, so that people will attend to the change in the stimulus. And so if the stimulus never changes, children will stop paying attention to it. So we have to change it up and present things in a varied way. If we say, for example, what's your name, what's your mom's name, what's your phone number, what's your dad's name, we're teaching them that the word what and the word your are unimportant stimuli. Who's by the desk? Who's by the door? Who's by the sink? Who and by and is are unimportant in this type of sequencing. And the same, what do we wear on our head, on our feet, on our neck, on our body? What and we and where and on are all stimuli that many of the children, for those of us that work with children with a diagnosis of autism, tear our hair out working on pronouns and prepositions and verbs and so on. Possibly it's an issue of how we're sequencing things. And so, so looking at conditional discriminations, let's see if you can answer these questions. So the popular cola, it's not Pepsi, it's that other one, it's called Coke. And another name for a funny story is a joke. And a forceful little jab is called a poke. And the white of an egg is called the... It's the white of an egg is called the, not the yolk. So why did you say that? If I would have only asked you the last question, you would have not missed it. I know you know it's not yolk, but you stopped paying attention to the relevant stimuli because it didn't change. So let's analyze that. You can analyze this using information about conditional discrimination. So let's take a look. Coke, joke, and poke sort of set the stage for you to say yolk, and so I did it on purpose. Egg is what controlled you saying anything about an egg, and so that's why you said yolk. The prior learning blocked the relevant stimulus, that is, those unchanging, rhyming, sing-song stimuli set you up to not pay attention to what I said next. You paid attention to only the word egg, and immediately that evoked something that rhymed with poke, coke, and joke. And so that's how you can teach people to give you the wrong answer on things. So let's take a little bit closer look at conditional discrimination tests. It's one stimulus that changes the strength of another stimulus to evoke the response. So let me translate that. You kind of need to maybe hear it a few times. I know I did. The correct answer depends on attending to and responding to all of the relevant stimuli. So here are some stimuli. Here's our sample, and here are the items that I'm going to ask you to point to on my test. Okay? So this is a conditional discrimination task. Match to sample is a conditional discrimination task. It's not the only kind of conditional discrimination task, but it's one. So this stimulus you're going to respond to that stimulus. I'm going to fill in the blank, and you're going to respond to that. So this stimulus right here, this one that you don't know what it is yet is going to change the ability of this one to evoke a response. And it's going to strengthen the evocative value of one of those two. So if I say, find different, this stimulus changed the ability of this stimulus to evoke a pointing response to that one. Your ability to do this was conditional on this as it related to that one. So the right answer depends on what the stimuli are and whether or not you're paying attention to them. And we're talking about multiple stimuli, not just one, not point to, but point to the one that has a tail, that says meow, and so on and so forth. So if I say what walks, that's not really a very hard discrimination. You can tell me a whole bunch of different things that walk. But now I'm going to add on 2 feet. And that immediately strengthens the ability of some of those stimuli to evoke a correct response. Which ones? Those 2. So it's a conditional discrimination where one stimulus, this stimulus, changes the strength of those to evoke a correct response. And we call this convergent stimulus control. These stimuli had to come together. They had to converge to evoke the correct response. And that's what conditional discriminations are based on. So if you're going to analyze conditional discriminations, you have to understand about multiple stimuli, which ones you need, which ones you don't need, and how to put them together to evoke the response that you want. And we'll take a look at an analysis of that in a second. Last year, Mark and Sundberg and his wife Cindy Sundberg published a paper on intraverbal verbal conditional discriminations within the area of verbal behavior. And this is a subtest to sort of get at some of these conditional discriminations. Why is it so hard to assess and teach intraverbals? And so their interverbal subtest has 8 subtests to them, 10 questions on each subtest. And what they found is that there's sort of a fracture point between subtest 3 and subtest 4. Something happens with those items to make them more difficult. Of course, that's how they arranged the test, but what is it that makes the subtests 4 through 8 a lot more difficult than the ones 1 through 3? And this is information that appears on standardized language tests all the time, so it's useful to be able to kind of identify this. Simple what questions, naming, function fill-ins, animal sounds, so on and so forth, are either requiring a rote response, like what's your name, or many different answers can be correct. So like, what did you do today? Lots of different, what do you like to eat? Lots of different things could be correct. What runs, and so on and so forth. But on subtests 4 through 8, we see that these require verbal conditional discriminations, meaning that they require the child to pay attention to multiple stimuli that converge to evoke only one right answer. So, for example, these are subtests 1 and 2. You wash your, you can see where you can answer many different things to that. You sit on you sleep in a lot of different answers. You eat, and so on. But now we're looking at multiple stimuli. Where, take, bath. How old are you? Where are trees? Now we have multiple stimuli that have to be paid attention to, have to be responded to, have to be salient to the learner in order to successfully evoke a correct response on the test item. And on subtest 5 and 6, again, an animal with stripes. Not name an animal, but an animal with stripes. What do you smell with? Not what do you smell or. And you probably have seen that problem with what do you eat and what do you eat with a lot of the kids that you work with. What do you wear on your head? not just what do you wear. What do you wear on your head? What do you wear on your feet, and so on, although we would change the wording if we were going to put those questions together. So here is a child that I was working with. We administered the Sundberg and Sundberg interverbal subtest. And on item 9, subtest 4, item 9, this is the item. Who do you see on TV? And her response was, in TV room. A wrong answer. So what do I do with that wrong answer? I can use my analysis of the error and my knowledge about conditional discriminations to figure out how to fix that and why it went wrong in the first place. So what's missing or weak are who and see. Those are wrong, or weak rather. So multiple stimuli have to converge. Who, you, see, on, and TV all have to converge to control the response. So TV clearly controlled the response. She said, in TV room. What question did she answer? Where? Where's the TV? So how are we going to work on where questions? Or are we going to work on who questions? Or should we work on where and who questions? So let's take a look at what we really should work on here. Who and see were both weak to evoke the response. It could have been Dora or anybody else that she watches on TV. I think one of her favorites was Dora. And TV, in this respect, because these were weak stimuli at controlling a response, the TV was not part of this unit. So it only evoked in TV room. So what we would do, we pre-taught under manned, tact, receptive conditions, that is with pictures and with real-life stimuli, not under interverbal conditions where those are not part of that ABC unit, but with pictures and in real-life situations. We taught her to manned, tact, and respond as a listener to these two items right here, because that was the part that was weak. And then we get a correct response. So in summary, I have 3 points. We see on assessments for speech and language tests that MANs are rarely assessed. And although it was kind of a minor point that I didn't spend a lot of time talking about today, in my opinion, because MANs are so critical and so vital to the happiness of human beings and their success in functioning independently in the world, this is a strong, strong area that we need to it's a huge gap that we need to fill. So strong priority. Point 2, a response may not be evoked if multiple stimuli are required to evoke it. So on the tests, what that means is that you might not get a response on a test item if you're not saying just the right thing to evoke that response. So on the tests that we evaluated, we saw that testing might be discontinued if errors occurred on sort of preliminary tasks. Some tests have things called familiarization skills test, kind of a little pre-test. And if errors are made on that, the test is discontinued. But you still don't know what can they do. So you don't get a full picture of their skill set. On the tests that we evaluated, some required, a correct response required multiple control. That is, they needed to pay attention to multiple antecedent stimuli, but the response wasn't under that control. So even though I was testing something that required interverbal anechoic, they couldn't make a response under both of those stimuli. They could only make a response under one of those stimuli, and as soon as we added the other stimulus, they could no longer make the response. So there might be a partial skill that's not being captured. That would be important information for you to have. Oh, they can do it under this condition, but when I make it harder with multiple stimuli that need to control the response, we lose it. They can't do it anymore. So that's important to know, but I would want to know, well, what will evoke the response? What's the first part, the partial skill? We also saw in some of the tests that the correct response shouldn't require multiple control, but it does, and the learner can't respond without all of those. And that's a situation that we see more often. I say, name some animals, and they need to have other prompts or multiple control to evoke it. So I would need to say, for example, that run, that bark, that swim, that climb trees, and so on and so forth. So you might not be able to get the response to occur under the conditions that you want them to occur in the treatment setting in order to fix the problem. So this is critical information to have. And point 3, failure to describe the controlling variables has negative implications for treatment. It's a problem if you don't know what evokes responding. Again, prompts may actually control the response, but they may not be targeted for fading. So when you get into your treatment program, you don't know what to fade because you don't know what is needed to control the response that should stay there and the ones that should be faded out. And stimuli are currently required, but they're undesirable, and it may not be identified. And as an example for some of these, I'm sure you can relate to this story. I was working with a little guy who they wanted me to evaluate his speech and language skills, his verbal behavior repertoire. And so I said to the home trainer, the teacher, well, let's take a look at what he can point to. Can you get me a bunch of pictures that you know he knows, and let's just kind of get it started here. And then I was going to slip a few in that I thought maybe he didn't know. And so so I put a few out, and I said, where's the banana? Where's the truck? Where's the fireman? And where's the jacket and the shoe and so on? And he started crying and kicking me and wanting to get out of the chair. And I turned to the teacher and I said, what's happening here? I thought you said he knew these. And she said, well, you're saying the wrong thing. You're supposed to say touch the. So I said, okay, let's try that. Touch the banana. Touch the fire truck. Touch the jacket. No problem. He could do it all. So this was really helpful information. We brought it under different stimulus control in a nanosecond because we put touch at the end of all the other ones. Point to the jacket, touch. Where is the dog, touch. And then we faded out touch very quickly, and then sometimes we said touch the fork and touch the so on so that we didn't lose that one. But the stimulus control had never really been looked at as the controlling variable. What is it that's controlling this pointing response, the listener response? And if those details aren't attended to, then we lack direction for treatment. So just 3 research and clinical take-home points, things that I would like to see all of you kind of begin to do. And I think it would really strengthen both of our fields of speech pathology and behavior analysis. Just some ideas. I think that we need to identify the function of the kinds of things that we're testing on standardized speech and language tests. And I think the database that we reported a couple of years ago is a beginning step in that direction, but certainly there's far, far more to be done. That's just really the bare bones, getting folks interested and started with this issue. The stimulus control that's required for the various operants that we call verbal behavior. Number 2, I think it would be very helpful to define acquisition hierarchies. And I can give you an example. These are the foundational cumulative skills that need to be in place to support acquisition of more complex skills. So for example, if I say, well, he can't answer yes and no questions, it's really quite different for me to say, is this a glass? Is this water? Where you can verify it by tacting it. That's what I would call an easy yes-no question. There's a little bit harder on the yes-no hierarchy of difficulty. Is everyone here today? I could answer that through tact verification, but it's a little bit harder than verifying with a tact, is this a glass, is this water? Is everyone here? I don't know. I have to look around and I have to remember who sits in that chair and is that chair empty or not, and account for everyone else. That's what I would call a middle of the road difficulty level yes and no question. And now a harder yes and no question, but still it would be identified in the category of yes and no. Are you being safe right now? Are you being polite to grandma? Did you have fun at the zoo? Did you turn in your math paper? Did you eat nachos for breakfast? Yes or no? Those are much more difficult, and they clearly require other repertoires than is this a glass, is this water? We need to identify what are those repertoires, because it's not sufficient, for example, with just this one example in yes and no, to say this child has problem answering yes and no questions. And the third point then is to take all that information and translate it into assessments, function-based assessments. And certainly the VB-MAP is, I think, an excellent beginning point on that. I think that Mark Sundberg, the author of the VB-MAP, would be the first person to say that there is much to be done, particularly in the area of interverbal skills. So our goal, in closing, is to get information about what our learners need and to get it as quickly and as efficiently and as fully as possible. I think it may be harder to move from a familiar traditional approach to a more detailed behavioral approach. Certainly it's hard, but I think there are strong, strong advantages in making that effort. And I think this cartoon probably says it best. This would be a lot easier, Miss Reed, if you didn't require such pinpoint accuracy. 5 plus 2 equals 6, no. 8, no. So with that, I thank you for your attention and your time, and please feel free to email me if you have any questions. Question?
Yeah, you had a lot of really nice slides that talked about the assessments, the subtests, and then the verbal operants that each of the subtests was looking at. Is the actual presentation slide that you showed going to be available to us?
All of those tables with all of that information it's published in the paper that we published. And the reference for it is on one of the slides. I'm happy to send it to you as well if you want to email me. But yeah, that's a published paper.
Okay. What about the slides that have blanks? Like there was your definitions with partial blanks in them. So
yeah, those slides were they were not blank on the presentation.
No, they weren't, but they were on the PDF. So
Yes.
is there a way to get them filled in? If you
Oh, I guess I just thought people would fill them in as we were going through the presentation. Yeah, I'm happy to send you those. Sure. Yeah, just email me and I'll send you the PDF of the already filled in ones.
Barbara, I know that you and Mark have worked really closely on the VB map and have lots of data on developing the VB map. But is there anybody in the SLP or BCBA field that is coming up with a standardized behavioral language assessment that you know of?
Short answer, no. Not that I know of right now. Certainly, I think that's one of the things that folks are talking about because that is kind of where you have a lot of credibility. And the reason that is I'm sure, as you know, is that that's what's required legally for certain reports and school-based kinds of things. And so criterion referenced assessments, which is what the VB map is, I think are highly useful, as we all know, for treatment. But it may not dot all the I's for folks that are needing a standardized assessment. So when you see Mark, you should tap him on the shoulder and give him that suggestion too. Yeah. Okay, well, thank you.
Thank you. Thank you, Dr. Esch. Join me again in thanking Dr. Esch for her presentation this morning. It was certainly thought-provoking, and it certainly does challenge us to think a little bit differently about the way we provide assessments or conduct assessments and then provide interventions for our students with disabilities. So join me again in thanking Dr. Esch. Okay, our session verification code for this morning is LET 868. Excuse me. Again, LET 868. 8. LET 868. All right, thank you for joining us this morning. Lunch will be served at 12 o'clock out in the garden area. Thank you.